is for the Premier. COVID-19 is a public health crisis that has required extraordinary government action. But Ontario has another public health crisis that is crying out for urgent government action. A recent report found that 2,050 people died of opioid overdoses between March and December of 2020. That's an increase of 75% from the exact same time period of the year before. Speaker, that is 75% more deaths. But instead of taking action, the Premier has refused to remove the cap on overdose prevention sites that he imposed in 2018. So I have a simple question, Speaker. Will the Premier act now to save lives by removing the cap on overdose prevention sites?
Minister of Health.
Thank you, Speaker, and thank you very much to the member for the question. The opioid situation is very serious in Ontario. It has been for some years, but it certainly has been exacerbated by the pandemic. We are taking action. We have currently funded 16 consumption and treatment services sites, and there are still other municipalities that are still applying to become consumption and treatment services sites. So there's still room for others to apply. In addition to that, we have we've allocated up to $31.3 million for 21 CTS sites across the province of Ontario. And as part of our plan, our Roadmap to Wellness, our comprehensive mental health and addictions plan that was launched just before COVID struck Ontario, we have invested over $525 million more in funding, including $4 million for nurse practitioners for detox centres, $8 million for addictions day and evening care, and $3.5 million for home and withdrawal care vans that can move across areas that are difficult to serve. There's more that I can say in the supplemental, but it's something that we do take very seriously and are working on right now.
Supplementary question.
Speaker, everything is not okay. Public health experts are calling for action. The Ontario Construction Consortium just came out calling for action because 30% of the deaths are construction workers. Yesterday, Ontario Northern mayors came out calling for action on the opioid crisis. Just last week, I met with the drug strategy team in my riding, one of those 16 cities that has an overdose prevention site. And they said, Mike, can you convince the government to remove the cap so other communities can have the kinds of harm reduction services we have in Guelph? And so with all due respect to the minister, Speaker, I'm asking the government, will they remove the cap on overdose prevention sites and put more money into harm reduction services to help save lives?
Minister of Health.
Thank you. Again, this is a very serious situation, and I can advise the member that there's no need to remove the cap because there are still municipalities that are applying. We funded 16. There's 21 that can be funded. Municipalities can apply and make their case to have more consumption and treatment services centres. But it's not just about that. I heard you speak about harm reduction. We need to have investments made across the entire continuity of care for people to make sure that we can have the consumption and treatment services sites. We need more RAM clinics. We need more safe places for people to live for residential treatment. There's a lot of work that has yet to be done. We are working on a plan now, and we will be releasing the details of it very soon.